Alright, so now we're going to cover the superficial muscles of the model here. So we'll start off up here where we have, of course, the frontalis, which is also known as the frontal belly of the frontal occipitalis. As we move downwards, we can actually see that this circular muscles going around the eye. Here we have, of course, is the orbicularis oculi here and then here. And so this is going to actually, when it contracts, closes the eye, and of course it's responsible for wincing or forcefully closing the eye as well, so depending on the amount of contraction. If we move further towards the midline, you can see this muscle right here, which is called the corrugator supercilii, which actually brings the eyebrows closer together. And then right in the center point right here near the glabella would then be the procerus. As we move further down, we can actually see that there's a muscle on top of the nose, and that of course is the nasalis. Next to the nasalis, heading downwards towards the lip, you'll see that there's a muscle coming down, and this of course is the levator labii superioris, alicae nasi, because it actually comes off of the side of the nose. As we move further down below the orbicularis oculi, you can actually see this muscle right here, which of course is the levator labii superioris here, which leads of course to the lips, and then we see the circular muscle going around the mouth here, which is the orbicularis oris. Now if we move towards the cheek, heading upwards here, we can actually see that there's a muscle coming from the cheekbone down towards the corner of the mouth. This of course is your zygomaticus. That's what that is. As we move further down, you'll see that there's a muscle that comes from basically the masseter, which is this muscle right here, which has the parotid behind it, which is this glandular structure here, and of course this muscle right here, which is known as the rhizoris. So we have zygomaticus, rhizoris, masseter, and the parotid. In between the zygomaticus and the rhizoris is this muscle right here called the buccinator, and that's what that is. Below the rhizoris, this muscle right coming down all the way down towards the shoulder is the platysma, which covers the front part of the neck. As we move back up, we can see off to the side here we have the depressor anguli oris, which is here going in the corner of the mouth coming down. Next to that we have of course the depressor labii inferioris, and then right here we have the mentalis. As we turn back towards here, we can actually see the sternocleidomastoid heading upwards from the sternum, and a portion of it will come off of the clavicle, heading up and connecting together to form the sternocleidomastoid. And then inwards here, we have, of course, the sternohyoid. So here we have the sternohyoid. So platysma, sternocleidomastoid, sternohyoid right there. Now, as we then turn this way, we can again see off to the side the sternocleidomastoid here heading upwards. We can see that there's a muscle right above the ear, which is the temporalis. And then as we turn this way, we can see there's behind the temporalis towards the back of the skull, the occipitalis. And then we move downward and we have the trapezius right here. Now, if we then look at deeper muscles of the eye, of the body, we can actually see again the temporalis being here. And now we're moving downwards, and below the temporalis, we can actually see that in the inner area where the buccinator would be, below that, we'd actually have these two muscles here, which again are going to be the pterygoids, both the medial and the lateral. The lateral, of course, being further out than that of the medial.
One more time. Sorry. The pterygoids.
The pterygoids are classified as both the lateral and the medial, being the medial being further inwards than that of the lateral coming further outwards away from the pterygoid process of the sphenoid. So then as we move further downward, we can actually see that there's a couple of muscles here. Now you have to be very careful here because these two muscles can be confused, and you have this muscle coming down and heading towards the hyoid bone, which is here, and this muscle coming down towards the hyoid bone here. But this muscle is actually a part of another muscle right here. This muscle and this muscle are the same muscle known as the digastric. This portion is known as the anterior belly, whereas this process, or this portion of it, is known as the posterior belly. So this is the anterior belly of the digastric, this is the posterior belly of the digastric. And this muscle right here, which looks like it's actually part of the digastric, is actually the stylohyoid. And the way you can tell that is because this is actually coming from the mastoid process, not the styloid process, which is right there. Now, as we move further down, we can actually see here this muscle coming from the hyoid going down, and then it cuts across like so. This is the omohyoid. So we have the superior and then inferior belly of the omohyoid. So that's what that is. And sitting underneath it is this structure right here, which is known as the thyrohyoid. This muscle is known as that because it's coming from this blue structure right here, which is the thyroid cartilage, and it's heading up and attaching to the hyoid bone. So that is the thyrohyoid. Now, below the thyrohyoid and below the omohyoid right here is a muscle that's coming from the sternum and heading up to the thyroid cartilage. And so this is known as the sternothyroid. So that's what that is, heading up that way. And then off to the side here, we have the attachment of three muscles here, here, and here, which are the scalenes, named so as anterior, middle, and posterior scalenes, all attaching to the ribs. And then we have this muscle right here, which has a red star on it, which you need to identify on your own. So I will let you do that as a student in my class. All right.